Hey besties, welcome back to another episode of The Nurse Aspect where we assess and evaluate. I am your host, Nurse Becca, and today we have on the show Alleina. How are you, girl?
I'm okay.
Thanks for stopping by.
Thanks for inviting me and having
Of
me.
course, no problem. We're going to get right on into it like I always do with every episode. Tell me, why'd you get into nursing?
So my oldest sister always worked in the medical field, and I would say in the very early days, I was inspired by what I saw her doing, the environments I saw her in. Now, I always knew I wanted to be in the medical field, but I didn't know what. Was I going to be a doctor? Was I going to be a nurse? Was I going to be a tech? I had no clue. I had no clue. And it wasn't until I had my son at 19 that I was like, okay, I gotta get my act together.
I got to make some money.
Yeah, I need some money. I need some money. And yeah, that's where it all started. I just, out of the need to really provide, that was the push.
Okay.
But the inspiration was there because my oldest sister was always in the medical field.
Okay.
And I thought like, oh, the scrubs are cute.
Not the scrubs are cute.
The scrubs are cute.
So like, when did you start?
I became an LPN in 2007 and an RN. Very interesting because I didn't think about this until this very moment. So I became an LPN in 2007 and then an RN in 2017.
Oh, okay.
So,
That's okay. I honestly, I also started as a LPN too. I didn't start out right after high school. I took a long gap to try to figure out what I'm supposed to be doing in my life, and it took me a long time to also become an RN too. Like before, I was just like, all right, I need a break from school or whatever. By the time I went back, it had been some time, so that's fine. You here, and that's okay.
Yeah, I baby stepped my way into my RN because I was working 2 jobs. I had a child. Like I was like, I don't know when I'm gonna be an RN, but I know I'm gonna be one.
Okay.
And that was just, I was in no rush.
Okay. Did you work at a typical nursing home?
Never in my life, which is interesting because most LPNs have that experience.
Exactly. Crazy.
Yeah, no. So my first LPN job was at a community health center. And after that, school. And then I went straight into corporate nursing after graduation.
How'd you like corporate nursing?
I love corporate nursing.
Really?
So yes. So 2 things can be true, right? I can love corporate nursing and still love patient care.
Okay.
So for me, corporate nursing, what I loved about it is that I had girlfriends that had been in hospitals 5-6 years, and I was matching their salary.
Oh.
Straight out of nursing school, no experience, going into corporate.
So what was your typical day like for as a corporate nurse?
So with corporate nursing, so I started out in case management. And case management is just a mix of nursing and social work.
Okay.
Right? So you are managing their meds, you're managing their care, but you're also are concerned on whether or not they have food stamps and food in the fridge and or can afford their rent. So it's a mixed bag of a little bit of everything. And then I went into quality.
Okay. In terms of like your shifts, was it like a typical like 9 to 5?
Typical 9 to 5, Monday through Friday, no weekends, no holidays.
That's nice.
I know.
That's nice. I'm not gonna lie. It's nice. I'm not gonna lie. I used to be like, you know what? I can't do 5/8. Like 5/8 is a lot. And I do like the 3/12s, but the no weekends, no holidays. That sounds like I could make it work for that.
Yeah. It was pretty sweet. It was good. And when I started case management, we're talking about over 10 years ago now, right? Case management was so sweet. You got 60 members that you had to manage. Now case management has changed a lot. Like my friends that still do it tell me that they case manage up to 250 to 300 members a month. Yeah, that's a lot. It's a lot. It's a lot.
Wow, that's crazy.
So it's not as sweet as it used to be, but it is a good way. It's an entry into corporate nursing. You can easily work your way up to quality and other departments and, whatever aspect you find interesting.
Did you go up in corporate nursing, or like did you?
I did. So case management and then quality assurance auditor. Still in clinical.
Okay.
Right. But it's very different from Bedside, right? So like I was a little jealous of my friends who had the bedside experience. I'm like, man, I'm gonna lose my nursing skills. If somebody choke right now, I don't know what's gonna happen. I'm calling 911.
You looking up? I could call
Yeah.
and I could might start some CPR for you. and
Yeah,
that's about
Mike
it.
could, but Mike cannot. So I'm not. Better to chew very slowly and swallow. Because we don't know what can happen. Yeah, but so I missed the experience of connecting with people
Okay.
in person and really nursing people. Case management, there's something special about case management because the members are assigned to you and they'll be with you until they expire,
Oh wow.
right?
Wow.
Or unless they change their health plan, you know, then you might stop speaking to them, but you get close, even though it's just a telephone interaction, but it's once a month. It's more frequently if the person is sickly. You might need to contact them more frequently. You get to know their families. It's like you become a virtual family member.
Wow.
Um,
Would you ever have to go to like people's houses at all or no?
I didn't have to, but
Okay.
there were times that I did because I would get invited.
Oh, nice.
Yeah,
Okay.
yeah.
Wow.
And so my supervisor at the time was like, these people keep calling for you. Just, yes, go see them because they're driving
Wow.
us crazy.
Wow. Okay.
Yeah, so when I started my business, I got to connect with people again in person.
Okay. And what are you doing now?
So I'm a post-op nurse. I provide post-op care for people who have had plastic surgery,
Okay.
whether that's a facelift, breast augmentation, tummy tucks, lipo 60, BBLs. And I love it. I did not know that this is where I would end up at.
Okay. Because I was just about to ask you, how did you end up there?
So I had I tried to unbig my back.
Okay.
I had lipo. I had lipoed my back and needed post-op care. And what I found is that everyone knew what to do, but didn't know why they were doing it. And as a nurse, we need to know the why.
Yep. Okay. Clearly nursing school stuck with us.
Right. So it just irked me that everyone was like, well, this is what you do. And I'm like, okay, but why are you doing it? And when do you not do it? And there was no real answer. So I went down a rabbit hole and I started doing research and I started contacting professionals in this industry that have been in it for very, very long. I paid a lot of money to study underneath them and developed my own technique and my own practices. And I would like to say I think I'm one of the best in the industry.
I mean, that's dope. That's dope. I mean, it's not something that it's not a typical nursing field. Like just like you said, like, you know, most people at the hospital or like, you know, aesthetics is becoming more popular nowadays and stuff like that. So that's pretty dope that you have your own like post-op care now. I know you said that you did not work at the hospital. So like, it's interesting that you don't have like a typical, even like a regular post-op from the hospital background. Yeah, that's pretty dope.
So I think that much like any other specialty in nursing, if you have a good preceptor, you're going to do well. So for me, it was understanding that I couldn't be biased, that nurses don't know it all the time, right? Like we know a lot. Yeah. We know a little bit about everything.
Yes.
Right?
Very true.
But we don't know it all. So I had to understand like how different providers, different practitioners like chiropractors, stretch therapists, physical therapists, you know, what they did that could help my patients recover better.
Okay.
And so I studied under them. I read countless, you know, studies and articles, like just saturated myself. And nursing was an excellent foundation for what I'm doing because you need to know.
Yeah.
I've had medical emergencies where I've had people pass out on me.
Wow.
Because they're not eating well, because they're taking, you know, the oxy and they're not accustomed to taking it. Their system is not doing well on it. Just many, many different reasons. So the nursing was an excellent foundation. If I'm honest with you, if I were to get surgery again, which I am.
Oh yeah. Okay.
Yeah, I'm definitely going to get on the table. I work with some of the top surgeons in New York, specifically Dr.
Well,
Kalsow.
before we even like go there,
Go
what
in
is
there.
the name of your business? Because we skipped
Yeah, we
right
did so
past
much.
that.
So my business, I came up with this name before I even knew what an incorporation, having to be incorporated was.
Okay.
I sat up all night and I'm like all over Google. And I'm like, what's the experience I want people to walk away with?
Mm-hmm.
So I searched till 5 a.m. and I came up with ethereal. And it was like, it's a word that you don't really hear much.
Mm-hmm.
Most people have a hard time even pronouncing it when they see it written anywhere.
Okay.
But the definition to me was everything that I wanted. It was what I wanted people to feel like when they were in my care.
Oh, nice.
So Ethereal Touch Body Studio.
Okay. All right. I mean, that sounds like, honestly, if I was like thinking about it in terms of like doing surgery, I like how it sounds. Like, you know, I would want to feel like an ethereal queen, like I'm above everyone
Yes.
else and like looking down on you because you see my body.
Okay.
You see my
It's
back
heavenly.
body. Okay. Exactly. I feel like heaven. You're welcome.
Yeah.
That's exactly how I would want to feel. So I love that.
Yeah.
All right. And you said that you were working before, you said that you're working with the top doctors.
Yeah. So I've worked with some top surgeons here and in DR and Columbia. They refer patients to me.
Wow. Okay.
Specifically here, I would say I have to pay homage to Dr. Kalsow because I've learned a lot under him. He's been super generous with his knowledge and his time with me. I've gone into the OR with him, watched him master his techniques, and in turn made me a better nurse because if I can see what he's doing in the OR, I understand that patient's needs even better coming out. So.
Wow. So what's your typical day like in terms of like, let's say you have a client that just did exactly what you did, like liposuction. What's your typical procedure with them?
Okay. So when you get liposuction, you get something called tumescent fluid that has to be pumped inside of you in order to draw out the fat. This fluid should not sit in your body.
Okay.
It can. Will you recover? Sure, because your body is amazing and will learn how to recover, how to get rid of this, essentially this toxin that's sitting in your system, right? But we like to facilitate drainage so that the body can expel this fluid a lot faster than if you just sat at home with it. Because the faster we get the tumescent fluid out of your body, the faster you recover and the less discomfort and pain you have.
Oh, okay.
So that is really the key. And having the right post-op provider is just as important as having the right surgeon. You know, nurses, we understand infection control. We understand, I can already see some complications that patients are going to, I can foresee it and start doing interventions before we even get to the point where, you know, we can't fix it. So really just with practice, you start seeing different things, learning how to treat it. Yeah.
Post-op care generally obviously starts right after surgery. There are people that
The day after.
Right. So like there are people that I know who would go for surgery and they don't really even think about post-op care, or like they look at the cost of post-op care and they're like, nah, I'm not gonna do it. Yeah.
Yeah. So if you do not have aggressive lipo, if you are one of those people that just goes in for quick cleanup every couple of years and you've got good eating habits and you're generally a healthy person and you might work out, because yes, people that work out every day still get lipo.
Okay.
You may not need aftercare. If you do not have more than 2 liters of fat removed, you may not need aftercare. You could probably sit at home and be okay. However, that's not your typical patient walking in, right?
Okay.
Most people are getting, in New York, the limit is 5 liters, and most people are getting their 5 liters removed.
What's the state that has the highest?
So Virginia has no limit.
Oh.
Yes.
Okay.
Virginia has no limit.
I didn't know that.
And Miami, even though everyone flocks to Miami is 4 liters right now.
Oh, it's less than New York.
Yeah.
Okay.
Which it should be, because, you know, there are some great surgeons in Miami, but it is known for being the Wild Wild West. Surgeons go out there and just, I don't know, do all types of unconventional things.
Well,
So,
yikes.
yeah.
What do you say to people that like go for like, end up with like a botch surgery, or like, because surgery is becoming more and more popular these days, there are
Mhm.
people that are actually dying, from doing procedures. Like what would you say to someone that is maybe going into it, either in terms of either doing research?
Yeah, so what I would say is hire someone who is knowledgeable to consult with. I know a lot of people don't think of it that way because surgery is no longer taboo. Everybody's talking about it, everybody's getting it. You know, you
Mm-hmm.
can easily sit in a room and if there's 10 women, 7 of them have had some type of procedure.
Mm-hmm.
But there's no amount of research online that's going to prepare you for recovery. And what I like to tell people is plastic surgeons know plastic surgery, but they don't understand recovery. Hiring someone who is skilled and knowledgeable is going to be key because you can sit at home and decide that you're never going to get post-op and you will recover. As long as you don't have an infection, you will recover.
Mm-hmm.
But are you going to have the look that you want? For me, I have a very strict regimen. My clients will tell you we discuss their sleeping habits.
Mm-hmm.
I need to know what your bowel movements have looked like.
Mm-hmm.
Um,
That's a
I
real nurse right there.
yeah. So they go on a sodium restricted diet,
Mm-hmm.
and they have a certain amount of water that they have to intake depending on their weight. It's all these very specific, which is why I don't take on a lot of clients anymore. When I first started, I'm like, sure, I can see 9, 10. Like literally, I was seeing 10 people a day.
Mm-hmm.
Like leaving my practice stumbling. And now I'm like, you know what? 5 is my max. 1, I'm getting older. But 2,
You don't look like it.
girl, it's the good genes. But it is taxing, and it's taxing on your body, but also on your mind because recovery does a number on you physically, but mentally as well. A lot of people don't know that many people go through something called post-op blues,
Mm-hmm.
which is where you experience depression during your recovery because it's a big lifestyle shift. You're not going out with your friends. You can't eat, the chicken wings and French fries from the corner anymore.
Mm-hmm.
Can't have a drink, can't smoke. It's all these
Mm.
things that people don't really mentally prepare themselves for. So one of the things that I like to do is when people first reach out to me, I provide them with a free consultation call.
I was just going to ask you, do
I
consultation?
do.
Okay.
Only for my surgeons' patients, or they're free. They're free. And I like to, when they first reach out, I'm like, congratulations on choosing you.
Oh, nice.
Because especially when you have people who are parents, I want to say, because a lot of men are getting surgery too. It's so hard to do something this big for yourself. So a lot of people have a lot of guilt behind doing something nice for themselves.
Mm-hmm.
And that immediately changes the mood. They're like, oh, thank you so much. And then now they're excited about it again because it can be scary. It can be very scary, especially when you think about, oh my God, a doctor's going to cut into me, suck stuff out, cut stuff away.
Yeah.
I may not make it. You go online and you read all this
Right.
stuff,
Yeah,
people
it's
dying
scary.
and
Right.
people being botched, like you mentioned. But if you do the research your surgeon, research your provider, and you'll be okay. As long as you're ready. Like, you have to be at optimum health too. If you have medical conditions and issues that are a concern, don't do it.
Mm-hmm.
It's not worth it.
What are some red flags would you say in terms of, like, let's say I have no idea what I'm doing in terms of like research, and I'm looking up Dr. Smith, who is quote unquote popular. What would you say are some red flags for people to keep a watch for?
So for most surgeons, you want to be sure that you're able to see a lot of their before and afters.
Okay.
And for the particular procedure that you want to go for, you want to see that this doctor has been doing these procedures at least for 5 years minimum.
Okay.
Because that seems to be most surgeons' sweet spot.
Okay.
Anything before that, they're practicing.
Okay.
So
we're a resident.
Yes, and we don't want you practicing on any body parts.
Correct.
Yes. So, but a lot of people will do it because they're looking for a good price point.
Okay.
Right. So pricing is always going to be a thing. If a surgeon is if a surgeon is inexpensive, there's a reason.
Mm-hmm.
Right. This is one of those fields that you get what you pay for.
Okay.
Like, most people have reached out to me and said, oh my God, well, your sessions are so expensive. I reached out to somebody in Queens or in the Bronx, and their sessions are like a fraction of yours, like $60. I'm like, great. You know what I want you to do? I want you to reach out to that person. I want you to book them one session, just book one session with them and one session with me. 99% of the time, they stay with me because the service is very different.
Okay.
Once in a while, you get someone who can't afford you, and that's fine. I'm not going to be for everybody.
Mm-hmm.
But generally, my knowledge, my passion, and my care usually is my selling point.
Okay. I could tell from like just the way that you speak about like surgeries and stuff like that you love what you do. It seems like, just even from corporate, you would mention how like, like the families would even
Yeah.
want you to come, like
Yeah.
invite you to stuff. And that's definitely not typical. So I'm not surprised that like
Yeah.
seems like you have like a family kind of
I do.
relationship
So
with your
I
clients.
tell people all the time, I think no offense to you, because I know you're a younger nurse.
Oh.
Okay. But I'm from a time where really if you went into nursing,
Yes.
it was a work of heart. You know what I mean?
Uh-huh.
It was really something that you did because you were a caring human being.
Mm-hmm.
Because nursing has become so lucrative, and I'm not mad at it.
Okay.
Nurses, get
Clock
your coins.
it.
But because it's become so lucrative, you have people going into it that are really not compassionate.
Yeah.
Are not caring.
It's true, yeah.
And it shows. It shows in the work that they do. For me, I always tell people, nursing chose me. It chose, like, from the moment I was like, okay, this is what I'm gonna do. That was it. There was like nothing. There was no other option for me. It's like, okay, this is what I have to do. This is what I'm happy doing. I'm happy nursing people. I'm happy talking to people. I would say the only other thing I could have done if it wasn't nursing would be like, I don't know, psychotherapy.
Oh, okay.
I would say like, as part of like connecting with people and giving them space to
like just let them talk and be who they are and not judge them and stuff like that.
Yes, that's one of my favorite things to do.
Honestly, that it kind of does go hand in hand with nursing. If you are a compassionate nurse, you have empathy, you have like a caring heart. It does go hand in hand. There's times when just at the hospital where like I have a patient that maybe is going through something. I have a way where I can talk to people and still be human and also be your nurse and literally nurse you back to health. And it doesn't matter what field you're in. If you are a good nurse, you can really excel in any field, whether you were in the hospital or not, home health. You could be whatever, starting your own business. You still need that compassion, really, like to be a good nurse. So I love that you do that. Have you ever come across any like botch surgery, like where people are coming to you and it's botch? It's not from anybody that maybe you worked with or anything like that.
So botched, not so much. I would say the closest thing I've come to seeing someone who was botched is someone who had gotten butt injections, and it was like foreign matter. We couldn't even make out what it was. And one of my surgeons was working with that patient to remove it.
Oh, wow.
And so I don't know if you've ever seen it, but when you remove this, it causes a lot of trauma to the tissue.
I've seen that. It looks almost like dimply. And
It's
so
dimply, it's deformed.
Yeah, right.
Yes, I would say that that's the closest I've come to seeing anything, to experiencing working with anyone who was botched. But what I have seen a lot is complications like infections. A lot of people who travel to get surgery.
Okay.
Oftentimes because they're not given proper instructions on how to care for themselves after surgery. You gotta bathe with Heba Cleanse, a day or two before and a day or two after. Then you have to transition to an antibacterial soap for a few days. You gotta make sure you wash your faja, which is the post-op garment that you have to wear that provides compression to help relieve some of the swelling. You would be surprised you're not gonna be surprised because you're a nurse. A lot of people are not great with their personal hygiene.
Yeah.
And so I talk about that. When I have my post-op consultations, how to bathe, when to bathe, how to wash the post-op garment. All of that is discussed.
I know you mentioned that. You said that you typically do about 5 clients now. How long typically are your clients with you?
So the typical session is anywhere between 45 minutes to an hour. And recovery, I'd like to say most patients are with me for 3 months. Like the 12 weeks is the acme of recovery. However, many of my patients continue to stay with me and they go into maintenance phase,
Okay.
which is where they come in once or twice a month. We do sauna, we do cavitation, radio frequency. These are things that help tighten the skin. So it's all about just maintaining what you just paid thousands and thousands of dollars for.
Okay.
Also, I'm quick to tell them, girl, you gained 5 pounds. What's happening? So I really think that's
not
why.
the trader nurse.
Yes, I'm going to tell you, because you just paid $15,000 for this tummy tuck or more, and you slipping.
Well,
And if somebody would have told me, I wouldn't be thinking about another procedure right now. Maybe.
Really?
Maybe.
Oh, do you think you want to do lipo in your back again?
I would want to do lipo 360 again. Dr. Kalsow is really one of the best surgeons in New York City. He has mastered his craft. I've seen what he's done for people with less foundation than me. So I would love to see what he does.
Not less foundation, honey.
Yes. That's putting it nicely. But I've seen what he does, and I would love to see what a sorcery he can work on me.
Okay, you got the magic. Okay.
He does.
All right. In terms of, I know you said you mentioned that you would do like psychotherapy. In terms of like your business, where do you see your business going like forward in the future? Do you see it?
So my business is a one-woman show.
Okay.
And that's by design. I find that a lot of people that go into this industry go into it for the wrong reasons. Again, much like nursing. It can be a money grab. And the way that I would want the service delivered, it's going to be very difficult to find someone as dedicated as I am, that's willing to do the work, that wouldn't want to just branch out and do it for themselves.
Okay.
Once they're trained and can do it, right? So for me, this is my baby for now. And I think that the future has something else for me. I think I've met enough people in the 5 years, almost 6 that I've been doing this, that if I walked away from it tomorrow, I'd be sad, but I'd be very satisfied with the work that I've already done.
Okay. That's great. In terms of like, if somebody was like trying to follow this exact same path or something similar to what you're doing now, what would you tell them?
I would tell them to invest in their education. Okay. Invest in learning, be humble, and do a lot of shadowing. Pay. You gotta pay. People have paid a lot of money for their knowledge, and if they're gonna share it, they want to be paid. So you're gonna have to prepare to spend a lot of money. Because this is not an industry that's regulated yet, there isn't a school that you can go to and be like, okay, I want to learn post-op care. There is a school that is a massage therapy school that has developed a post-op curriculum, but it is not nearly as close as to what I do. Okay. Because its origin is massage therapy. And while there's a lot of massage therapy involved, like the modalities are intermixed, it is not just massage therapy. So in this industry, anyone can wake up and say, okay, this is what I'm, in fact, you have a lot of people that have wake up and say, okay, this is what I'm going to do. And don't do the proper research and don't get the proper education and don't got the proper skill set. So it gets dangerous. It gets sticky. But this industry, because it's aesthetic, if you look the part, you're hired, right? So if I look like I've got 360 BBL and all the things done, then more than likely people are going to book me. But you really should be doing do the research, spend time studying. I think that outside of my nursing skill set and education, I probably spent an additional 6 months learning before I touched a patient. Wow.
Yeah. Okay. That's pretty dope. I love that you are like, this is something that's totally different. I think there are a lot of people who feel, who either want to get surgery and maybe are like ashamed to do it or even get it and they're like, no, this is my body. Like or whatever. So I love that you are so open and sharing and that you offer this type of service to people. Like, I think that that's great. And the fact that you do also have a nursing background, like you have the medical knowledge to also back up everything that you're doing. I don't think that, your purpose to me is definitely not wasted. Like I think that, because everybody's journey is different. I did not, I mean, I obviously went to school and I became a LPN, but I went the typical, I'm in a nursing home, I went back and got my degree, and like I'm in a hospital. So it's like the fact that you're or like literally on a total
Yeah,
different
it's different.
ball game. I love that like you help people in that way.
Yeah. So really, you mentioned something that there are people who want to get surgery. This is my advice to the girlies that are on the fence.
Mm-hmm.
Just do it. If you can afford it,
Mm-hmm.
do it, because I understand what it's like to look in the mirror every day and not like what you see. You know, we are so harsh on ourselves.
Yeah.
You know, we rarely have kind words for ourselves when we look in the mirror.
Yeah.
And I think that if you can afford to change whatever it is that's bothering you, do it.
I think that's great advice. That is great advice. Thank you so much for coming on the show and sharing your knowledge. Oh, before we even end anything, tell the people where they can find you. Where can somebody book a consultation, honey?
Yes. So the easiest way, so you can find me on Instagram, Ethereal Touch Body Studio, or really the fastest way to get a response is to text me 646-905-6768.
Not the numbers, the actual numbers,
yes,
y'all.
the actual
numbers. Run it down. I love it. But
I like to speak to people.
Listen, okay.
I do. I always tell people the post-op consultation call for me is the opportunity for you to get to know me and for me to get to know you, because you may find, hasn't happened in history yet, but you may find that you don't like me. And I may find that I can diagnose you with 3 different mental health issues. And
it hasn't happened yet. I never met a person that didn't like me. I love that.
Yes.
No, but I love you for, like I said, coming on the show. This is amazing. If you ever change anything in terms of your business, you're always welcome back to share. I'm sure people would want to hear from you.
Okay, cool. So look out for my little real estate guru, something loaded.
I
don't know,
Listen,
put the coin somewhere else.
Okay, that's totally fine. If we have to hit you up and you on a beach, we know why.
That's right.
Thank you so much.
Thank you, Rebecca. This was fun.
You're welcome. Thanks for tuning in to another episode of The Nurse Aspect, where we assess and evaluate. Quick question. Are we connected? The Nurse Aspect podcast is available across all major platforms or wherever you listen to podcasts. If you ever want to be on the show, or if you have questions, comments, and concerns, email me at thenurseaspect@gmail.com. Follow me on Instagram at The Nurse Aspect, or on TikTok at The Nurse Aspect for nursing nonsense and more. Until next time, nurse on, assess, and evaluate.